This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
The other thing that I find refreshing is the increased focus on the well-being of the workforce. And that means let's check in on how are we doing with retaining, what are the needs of our employed population, our employed workforce, housing, transportation.
Welcome to Sg2 Perspectives. I'm your host, Trevor DaRin, and I have Bill Woodson here with me today because the last probably half dozen times I've talked to Bill, he's been in an airport, which is always exciting because it means he's been with a lot of you members. I want to hear what Bill has heard from the road. Bill, thanks as always for joining. Where you been lately? What's been top of mind for those boards, leadership teams, health systems, others across the industry you've been talking with?
This is a seasonal effect in healthcare. So right about now, it's either going to be a board meeting or a leadership team retreat of some sort. They fall into certain categories. It's extremely hard to generalize, Trevor, but I've been in 7 or 8 states in the last couple of months, and that's a variety of local, regional, and in some cases national systems. I find things are going into bifurcation. That means there are organizations that are working on things that are actually going well, so let's continue, and then let's stabilize some other initiatives that are showing some promise and progress. The flip side is other systems that are saying, let's stabilize some things that are showing some promise and progress, and then let's blow some other things up. And in the latter category, that may be more about a new leadership team is finding its sea legs. There's been turnover at the top, and or they're restructuring how their regions come together, how they function as an organization, maybe new people at the senior levels of the organization overall.
Have there been any themes, whether it's by hospital type, regional, that have popped?
Yeah, there is the general theme of what in the world does system mean to us right now, and what is our area of focus as that topic comes up, and where do we think we weight as a system that's come together. And underneath that, it could be a matter of board relationships, management structures, service distribution, but even more discreetly, it's what are we going to work on to address consumer access as a system together? Do we have several operational initiatives that have to work more broadly and consistently across the organization? We're struggling with data governance and the richness and the opaqueness of data that we have to make decisions with right now, and that's in any category you'd like to define. What's our relevance in each of the markets that we're operating in, and how does that affect our decision making? And then implementation, so which gets us into a discussion about what is the role of the strategic plan right now, and it really does vary depending on the organization that we meet with. Is it a roadmap for what we're going to do next? Is it a path to differentiation, or is it more of an operating plan for what we got to get done in the next 12 to 18 months? Other topics that would be on anyone's list relate to workforce, economics, technology, and partnerships. All those are in play in almost every organization.
What's the outlook for next year? This time last year, at least the tone I was hearing was pretty measured. We'll probably continue to make a little progress, but it was progress from like a 1% to 2% margin, and people weren't very hopeful that they were going to be able to outpace that. What's the outlook now?
As you can imagine, there are some outliers here. There are systems we work with that are in fast growth markets, and they're making very different decisions about what they're going to do and how quickly they're going to grow and where they deploy their capital. For the most part, it is, we're not seeing much improvement in our commercial contracts. We're looking at very closely how quickly our government business is growing. That's Medicare and Medicaid. We are pessimistic about Medicare Advantage, but we settled into what we think the operating margin outlook is going to be over the next several years, and then we have to decide what we're going to do underneath that. We're going to focus more on revenue quality on the expense side. And then what gets into the next chapter is, given the things that we think we can succeed at, will we have the capital capacity to grow in the way we want to? So it's moved into a fairly nuanced conversation about how we're going to invest our more precious capital dollars. And just an aside, there's plenty of facility work going on across the country right now. However, it's 30 to 40% more expensive depending on the market. So that's affected the pace, the scope, the focus of what that work is right now. And that's going on in every organization that we work with.
Later this week, we're going to talk to HGA about exactly what people are building, how they've made those trade-off decisions. I'm really looking forward to it. That's a great overview, Bill. Give us some stories. Give us some specifics. Where are health systems making bets? What things are on the table that are not ready to move on yet, but they wanted to talk about and discuss?
Let's take this in a couple directions. What's in the room that maybe was not in the room a year ago? And the technology conversation has moved beyond the shiny object into what are we really going to do? What's our perspective on what aspects of AI are we going to invest in and deploy? What other technologies matter for the system right now? Where that's coming from is just a recognition of what the workforce constraints are going to be and the urgency of redefining the clinical operating model for healthcare. Questions I always ask about now is, what are you doing with the ambient technology terminology right now, the ambient documentation. Almost every system is piloting something like that. The same applies for a virtual nursing model. Lots of enthusiasm there. Still early and mixed on kind of the ambient documentation, but systems being more comfortable saying we're going to have agents, we're going to have co-pilots for certain things that we do in clinical care. Lots of work going on behind the scenes on revenue cycle, billing, and it's worth just noting the headlines from the last couple of weeks. So we had 4 large systems in the U.S. come together in a partnership. We'll see what they do with it. Who's that, Trevor? I think that's Longitude Health. So that's Baylor, Novant, Providence, Memorial Hermann. Their first 3 priority areas are cellular and genetic therapies, which the pharmacy discussion comes up more and more in the meetings that we're in. Second area is value-based care. And it's been interesting for me to hear the perspectives and the acceleration that's going on in certain markets across the country. And then the consumer-facing issues of billing and navigation. Those are consistent themes. To me, it's interesting that these 4 systems are going to try to do something at scale at it, and they're recognizing these technology plays are going to matter, not only for revenue for diversification, but just for operations moving forward.
I want to go back to 2 of those things. One, the longevity health piece. I'm almost surprised more systems aren't on board with that. It seems like a few places where scale should be an advantage and experience in those areas should benefit the others who haven't had as much experience, and there should be some pretty easy shared learnings. It wouldn't surprise me if either others jump on board or other models like it pop up. Why do you think it looks unique? Is it just the complexity of getting it off the ground?
Structuring these things, managing them, governing them has been difficult. And what they announced, which I find hopeful, is they're hiring 3 specific CEOs for these 3 aspects of the business. That demonstrates that they've got capital resources behind this. And one or multiple of them have existing platforms, investments that they believe they can scale. And maybe that's just where we are. Trevor, you and I have seen lots of announcements like this through the years that come and go. But let's stay optimistic about this one because those areas are going to matter to every system right now.
Yeah, the other piece I wanted to come back to is your comment on value-based care. What have you heard? Any change in who's investing, how systems are looking at it? I haven't heard sea changes, but it's just becoming more of a norm that people are taking on risk in, especially MA, or at least going for shared savings there. What have you heard?
Yeah, let's be careful about it because there are still plenty of CFOs who are skeptical. It's just a sample of the organizations I've been to that seem bullish isn't the right word. It's more an acknowledgement that where they're going to head is total cost of care and understanding that downside risk is in their future. And some systems, they're already there. The one system that's already, they said 30% of their business is tied to downside risk right now. That's unusual for us to hear. CMS continues to say we're going to have a very large percentage of Medicare in risk models by 2030. Some recent headlines about what's working the best. It's the traditional shared savings programs, and the key in those programs being primary care physicians. Still the secret sauce to kind of achieving the savings that Medicare is looking for. We hear consistently that Medicare Advantage is not working, at least at the reimbursement level for providers at this point because of denials, processing, and pre-authorizations. The other side to this is, depending on the state, interest in Medicaid, which we mentioned early on this year. So that's Medicaid managed care. And then depending how closely you follow this, we have distributed payment programs. We have some states that are offering commercial payment rate parity for certain Medicaid services. I met with a CEO founder of a company this year that's focusing exclusively on adolescents with eating disorders. And that company is building programs for Medicaid in specific states because they're going to get commercial reimbursement rates for it. And they're actually also building facilities, not just programs or virtual programs, but actual facilities as well.
Something we've talked about for a long time, and we've seen it in bits and pieces, is thinking about consumer segments where systems have a differentiated offering where they can tailor their approach. We've seen it more in primary care. Have you heard any systems saying, we think we can win in this space, and we're kind of doubling down there?
I have not. We try to bring it up in any conversation and you get the nods in the room. Definitely segments as it applies to certain aspects of the Medicare population, the dual eligible side, those are more payer categories. But in terms of robust consumer segmentation, if anything, it's just more robust conversation about what our programmatic offering should be in each service line and what's our portfolio of services and where should those services be delivered.
All right, going back to 10,000 feet, have there been any new environmental factors or competitive factors you've heard that people are paying closer attention to or that they think are impacting their strategic choices in a way that they weren't before?
Versus what we've talked about over the last couple of years, I would say less urgency on the disruptor players in the market space and what they're doing or how quickly they're moving. We've seen the headlines this fall with certain players exiting, Walmart, et cetera. The flip side of that is let's continue to pay close attention to what the payers are doing. That means Optum, United, and Elevance, their investments in the home care space. These are multi-billion-dollar investments, and also their plays in the physician marketplace as well. Depending on the market, that's worth more scrutiny And again, very market specific. How much is private equity continuing to play a role in the physician space? The topic that has surprised me, Trevor, is I've heard more systems raising the question of what's the future of our medical group? The economics don't seem to justify themselves in the way we've talked about historically. Have we hit some sort of inflection point where we're going to have to redesign this thing for a new model that's more about a sustainable economic model in partnership, an MSO model, maybe a special service group model versus a pure employment? The primary care decision about the economics inside the employed medical group is very much on the table over the next couple of years.
I've gotten that question probably the last 5 leadership teams and boards I've worked with, but I haven't heard them then take the next step to say, how do we take a more serious look at this? And are we really going to break it into pieces, or are we just going to try a couple more advanced alignment mechanisms?
I think it's a look forward model, which is what's our future model, maybe as physicians move towards retirement, and we're going to bring on board new physicians. And we're not going to do that in the traditional model we've used with employment and with RVUs, et cetera. So no one's really willing to jump in with this yet. A bit of anxiety that we're going to replace some of the things from the 90s, early in my career, with the physician place.
Any of that causing health systems list of priorities to shift? Do you feel like there's a couple things moving up the list, a couple things moving down the list?
If anything, again, there's this, for the most part, ambulatory first mindset. We need to find the right portfolio of ambulatory facilities, services, connect them appropriately to the patient journey. But if I think about the discussions, it's more internal about how we run the organization, how we shorten the list of priorities, how we simplify what we do, how we continue to make progress with our workforce. And the data continues to show us that there's so much work to be done despite progress in areas that matter so much. And that's building the pipeline, role definition, skill mix, how we deploy technology. But until that gets sorted out, it's very much let's get this working better if we're going to grow. There's this tension that goes on depending on how well the organization is working right now. Will we be able to move beyond capacity management into strategic capture of new patients for the business? That will separate who's going to be leading, who's going to be lagging in the next couple of years.
In a recent group discussion that I was hosting around primary care, I was really surprised that people were synced up, that the organizations are very focused on primary care needs to be out there expanding our footprint and as the access and growth channel. Even a year ago, there would have been more diversity of opinions about that. And people were just really synced up and in agreement that, yeah, that's exactly what the organization needs primary care to do now. That told me no matter where you are, what market, financial outlook, most systems see growth out there and know that they need to expand access to do it. That's going back to a traditional way of approaching it. I think people are going to try it in hopefully some nuanced ways, but it was surprising how in line everyone was on that approach.
For me, it's a point of frustration. And then I try and turn the conversation pretty quickly, or at least to acknowledge that the frustration in the marketplace may not be access to primary care for patients, it's access to specialists. And we're talking months of wait time to get into a specialist practice. No one has really cracked that yet, even though we have more and more members making same-day guarantees for access to primary care, whether it's your physician or PA or not, we'll get you in somehow. And then it's the data that we continue to bring up, which is no one has quite solved the continuity of care, the network integrity question. It's still pretty chaotic in most markets that we've been in. No one really has a well-working machine right now for keeping patients in the system.
Yeah. Most have some level of a concierge solve to at least have that as an option in their market. And it's so hard for me to say, absolutely, you should totally double down on that because sure, it's solving a problem for a sliver of the population, but that's not really what your health system is built to do. You can have it as an option. There's definitely a ceiling on how many people you can serve through that model. You should probably build other segmented approaches too. What really surprised you, something you heard? Did you get any curveball questions from a board member? Something someone wanted to talk about that you didn't expect based on their market or organizational history, or what's new?
A couple of things. There's an odd tension going on, and some of it may be generated from the physicians I have in my discussions about we're losing the core of the patient-physician, patient-provider relationship, meaning that intimacy, which they believe still matters. And yet we're also talking about how to scale these care delivery models. There's an inherent tension there that has not been resolved, but we have no choice but to do it through multiple means, including hybrid visits technology and recognizing that certain segments want certain approaches to care delivery. The other thing that I find refreshing, because these are more updates to management, and to boards, just the increased focus on the well-being of the workforce. And that means let's really check in on how are we doing with retaining? What are the needs of our employed population or employed workforce? Housing, transportation, what's the food sufficiency or access to grocery stores in their neighborhoods? What needs aren't we meeting for our own workforce that we can learn from to deploy more broadly across the community? That seems to have picked up, and I find that incredibly refreshing.
That's good to hear too. And I agree. I've heard the same thing, especially from boards. Like, they care when they see those numbers and they want to make sure they understand the story it's telling them and they want to see them moving in a good direction. Bill, anything you wanted to share that you didn't get a chance to?
I continue to ask, how well do your quality metrics correlate with your employee engagement / satisfaction scores? Theoretically, they should match up. In other words, the better engaged your workforce is, the happier they are. It should connect to how well you're performing in terms of clinical quality, safe and reliable metrics. That's not always the case. There's a lot to dig into there. That's part of what some of our other colleagues work on at Vizient with the safe, reliable work and the clinical database. There's a long way to go there. I'm heartened by the aspects of investment going to the data and digital side of healthcare that Vizient continues to make, how much work there is to do there. The boring topic that actually is incredibly valuable, at least coming up, is clinical documentation and how bad most systems are at that. And it's millions and millions of dollars on the table to be found if it's done effectively.
You mentioned ambient listening earlier. I heard one system who's beyond pilot and they've rolled it out to their whole group. And when they asked how it was going, the physician said, if you take this away, we're quitting. We can see 5 more patients a day because of this. And when I've shared that with others, that's been a common expected improvement in productivity. And that's incredible. What a positive story if that's like one of the big incremental improvements we saw this year.
Remember, you and I got the ultimate testimonial. We were at a physician retreat in New Jersey, and a physician room said she kind of had experienced this as a patient with her own physician and got to kind of look at the documentation, the note that was generated. And she said, I was very impressed, and it still has a ways to go. But the optimism there, the need to scale it, and the dollars behind it are extraordinary. And for those of you who are watching, what do you pay attention to, especially this time of year? Definitely tune into either the announcements or the calls themselves from United Healthcare and HCA, where their business is headed, what their outlook is for next year, particularly HCA. How are they generating revenue right now? Where are their capital dollars going? What's growing? What's not? It's extremely useful to us as well.
Good stuff as always, Bill. Thanks so much. Always value your perspective and insight. And thanks for collecting so many stories from the road. Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at Sg2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.